So, hey guys, I am a little bit out of commission, okay? Not only did I wear my shirt inside out today to the gym, I was really excited too because I like this shirt. And I noticed, okay, in the mirror, it's inside out, but that's okay. It's just that kind of day. I flipped it back, spray tan's rubbing off. Anyway, so the real reason I'm doing this video is because my elbow, this whole area has been killing me, aching so bad. I've been traveling, haven't been taking care of myself like I should. So I am lucky enough to have a friend who happens to be orthopedic surgeon, among many other things, who is going to inject my, or what they call tennis elbow. So he'll do all of the technical terminology.
Yeah, so a couple major problems that most common people come across in their daily, everyday wear and tear of the elbow are two things. Are tennis elbow, which usually occurs out here on the outside of the elbow, and for the golfers, they usually get golfer's elbow, which is on the inside, or they call it medial, and outside is called lateral. So today we are going to be taking care of her outside or lateral elbow. So first thing we're going to do is, I always like to start with an alcohol swab, and then we're gonna get the bad boy out. This is a Chloroprep. So this has 2% Chloroprep and also has 70% isopropyl alcohol. And you're always going to start, when you clean, you're always gonna start from the middle, and then you're gonna work your way out. Never.
The opposite, yeah. Bring the germs in.
You never want to bring the germs in. Always
out.
Yep.
There's not germs, that's spray tan.
No.
And I look very dirty.
You are not dirty at all.
Rubbing off like a Dorito.
So we're gonna let that dry for a minute. As she's drying, I'll talk about a couple other things. We are going to, where we know to inject, we're going to look for certain landmarks or anatomy. We're going to look for the lateral epicondyle, which is your elbow bone on the outside. So we're going to basically palpate or feel for that bone. Once we feel for that bone, there's a tendon that attaches there, the extensor carpi radialis brevis, and it inserts there, and once we feel that bone, we can feel that tendon, and once we go in there, we are going to get our syringe. In our syringe here, different physicians have their different formulations they like. I like
cocktails.
Cocktails, yeah. Sometimes I like to mix a few different things. I like to use Kenalog, and then mix it with a little bit of Marcaine. Some like to use lidocaine and Marcaine, or lidocaine with a little bit of epinephrine. I do like the epinephrine mix because the epi keeps the steroid in the area for a little bit longer. But there's some different combinations. There's methylprednisone too that physicians like to use. Now that we have that dry, what we can do, and I did pre-mark it, and the skin is already clean, so we're not going to do that again. But
so can I interrupt you
real
quick? So the lidocaine you said is like a numbing agent, and then the Marcaine, one's short acting, one's a little bit longer acting.
Yeah, so that's why they come up with different cocktails. So the lidocaine will work pretty much instantly. You feel a little bee sting, works instantly, and then you have Marcaine that works a little longer. Usually can take maybe up to 90 seconds, but that can work hours. So those are some of the things that they use for blocks, especially after surgery, where they block your leg, you come home, or arm, and you're numb for hours, and sometimes 12 to even up to 24 hours sometimes, depending on where the block is. So
right, so you could really numb, say, like a husband or somebody. You could really, if you got to get stuff done, I mean,
he's your guy. Like him,
I mean, or he's really okay, it's cheaper than, the alternative, or, okay.
A little Marcaine or some mushroom oil.
Okay, so I'm just being smart.
Yeah, so nice. But, all right, now that we're doing that, we are going to palpate for that lateral epicondyle we talked about, which we got right here.
Yeah. Ooh, I mean, it's good. It's like a massage. I'm going to go to sleep, everyone, because this thing's really been ticking me off lately.
And you know what we're going to do, since we are
Sorry.
for TV,
Doctor.
we are going to. So what you can do, certain.
I'm thirsty.
Have a sip.
The cameraman's telling me.
What we can do, so there's two trains of thought here. You can numb up the skin two ways. You can use cold spray as an antiseptic and numb it up.
Ooh.
Ugh.
Slippery
We're not
bugger.
using this, yeah. Or you can use some lidocaine locally, or you can mix it up like I usually like to do. But in this case, for a certain reason why, I am going to numb up the skin as well as have some epi or lidocaine with the.
So you usually have an assistant. You're solo today.
I do.
And you're doing fantastic.
I do. My assistant is the
Busting my
cameraman
chops
today.
right now.
So this is just to numb up your skin right here. So this is not gonna. You're just gonna feel a little bee sting. Doing okay?
Yes. When I had the.
Just think about somebody you don't like,
Oh yeah, no.
or squeeze something.
That's okay. When we did the stem cells, they didn't numb me, and they did injections, stem cells into each knuckle.
Ooh.
I mean, straight on. Chuck's like, I don't know how you are doing this. Like, without, I was like a trooper. They're like, I've seen grown men screaming. So I guess I have a high pain tolerance. I just like to complain a lot
No.
when I don't feel good.
That's usually toes and
Fingers.
fingers are pretty painful.
I don't know why they went right into each little joint with,
Yikes.
yeah.
All right, so we found our bone. We're palpating our lateral epicondyle. We are palpating our extensor carpi radialis.
And you can tell because my middle finger keeps like a little bit
Is
jumping.
moving,
Yeah.
yeah.
A little bit.
So it is extending, which it should be, and we are going to go in here.
Ooh.
So,
Jeez.
sorry.
Ooh, ooh. That's okay. It's so hard to know like how far.
You doing okay? That was the bone. You're supposed to hit the bone.
Ooh, nice. Can you pull back a little, right?
Pull
Or you
back,
told me?
yep.
Yeah, I think you told me that. That's okay, I'm okay. Hey, I'm okay, I'm okay.
And you are done.
Oh, thank you, doctor. Thank you. Oh, thank you. I'm hoping that this gives me some relief right now because I've been a big baby. I said I want to chop this sucker. I'm so annoyed. I can't.
If
I'm like
not-
this, one arm
Now
walking.
you're gonna chop my arm off. So
Not your fault. You don't know. I'm a complicated case. Yeah, I had you for the first time, and how long? You were like, I don't know. I'm gonna see my nasty spray tan.
it's okay.
Hey, it is what it is.
And when you check out, make sure you tell me you were good. You get a sticker and a sucker for the day.
Oh.
Any questions?
No, I'll be numb for how long?
Since we didn't put very much in at all. So
Okay.
it shouldn't be very long. An hour at most.
Okay.
We did put a little superficial on the skin, but we didn't put that long acting, so it shouldn't be hours.
And then keep the arm more straight today, and then wear my brace at night.
I would definitely wear a brace now for the next couple of days, because natural tendency when you sleep at night, what's your tendency to do? Sleep, bend your
Yeah,
elbow,
I
put it
do.
underneath the pillow,
So what?
sleep on your arm.
Yeah, I have a hard time all day. Maybe I should just like tape it to my side.
Well, you got to be a little more cognizant of what you do now.
I can't. How am I supposed to do dinner one-handed? Wait, I don't really. I'll cook all
So we're gonna have to get somebody to do that.
Chop, chop. Let's go. Thanks, Doc.
All right.
Bye, guys.